നമസ്കാരം പ്രിയ ശ്രോതാക്കളെ, ഇൻ ഫോക്കസിലേക്ക് എല്ലാം പ്രിയ ശ്രോതാക്കളെയും സ്നേഹപൂർവ്വം സ്വാഗതം ചെയ്യുന്നത് ഞാൻ രമേഷ് പയ്യന്നൂർ. ഇന്ന് ഇൻ ഫോക്കസിൽ നമുക്ക് ഒരു സ്പെഷ്യൽ ഗസ്റ്റാണുള്ളത്, ഡോക്ടർ സയ്യിദ് നാദിർ. ഗുഡ് ആഫ്റ്റർനൂൺ, ഡോക്ടർ സയ്യിദ് നാദിർ.
Hi, good afternoon.
Yeah, this is Dr. Syed Nadir. He's a specialist internal medicine, head of medical department and medical director at Untitled Hospital, Dubai.
Yes.
Sir, it is my pleasure to invite you to our show In Focus.
Okay.
And you have suggested a subject that is hyperlipidemia.
Yes.
I know you are well experienced in managing diabetes, hypertension, thyroid, cardiovascular disorder, and management and rehabilitation of stroke patients, experienced in managing gastroenterological disorder, experienced in managing acute kidney injury, as well as hyperlipidemia. So what is hyperlipidemia?
Yes. First of all, thanks for inviting me. Thanks a lot. Thanks for the station. The reason, first of all, I want to tell you why I chose the topic, because it's considered as recently be told as a silent disease. Mm-hmm. So, problem is, this is the problem. Mm-hmm. So now I will come to the answer of your question, that what is a hyperlipidemia?
Yeah.
Basically, it's I will try to be as normal English. I will try not to use medical term, but it's a condition in which you have increased cholesterol levels in the blood, or in other words, when you have too much fat cells in the blood, it's moving around, going around here and there. That's the condition. It's called hyperlipidemia, or it's called as a dyslipidemia.
Okay, that means hyperlipidemia is an umbrella term.
Sorry, didn't pick you?
Yeah, hyperlipidemia is an umbrella term that refers to any of several acquired or genetic disorders that result in a high level of lipids.
Yeah. Basically, these are interchangeable terms. There are, sometimes it's called hyperlipidemia, sometimes it's called dyslipidemia, or for commonly to understand, when the high cholesterol, also some people come, I have high cholesterol. Mm-hmm. So that's called, its conditions called as hyperlipidemia, in which the lipid or the fat cells in the blood becomes increased amount for considered to be certain levels. So then the condition is diagnosed as hyperlipidemia.
Okay. What is the prevalence of hyperlipidemia in Gulf countries?
Yeah, that's very tricky part. The prevalence of hyperlipidemia is basically, if you ask in the United States, around 93 million people are suffering from hyperlipidemia. And also this kind of number found in Europe. But if we talk about relevance in United Arab Emirates, it has been noticed that recently a study has been done. We don't have exact data, but a study has been done recently, which includes around 800 Emirati men and women. Mm-hmm. And on those studies shows that 72% of the people found to have hyperlipidemia. Mm-hmm. And out of those 72%, the interesting part was 42% found to have high levels of cholesterol, very high levels of cholesterol, which means they need medications. So that is the prevalence here. And I will relate the prevalence now, that the problem is dyslipidemia is often associated with heart disease. In UAE, the main cause of death is heart disease, like stroke, and those 37% of the fatalities are caused by those. So it's always linked to dyslipidemia. So that's why the prevalence is very high. And it's in a recent study, out of 800 Emirati men and women, it was found that 72% have hyperlipidemia. And the numbers are also high, more than 50 to 60% in the expect group. That's the prevalence here in you.
Yeah, that means it is very common in this area.
Yeah, of course there are reasons for that's very common, because of for expect, we can get easily food, irrational, very difficult lifestyle, so that's why it's very difficult.
Mm-hmm. Yeah, so many people have high cholesterol. In between, you have mentioned that high cholesterol is hyperlipidemia. Is it true?
Yeah, I will tell you. Basically, high cholesterol is hyperlipidemia. I will give you a bit brief that basically the question also needs to be asked that from where the cholesterol is formed in the body, if it's that bad. The problem, the part is the cholesterol is also very important for our body. Why? Because it takes a very good part in making hormones. It plays a part in the absorption. It plays a part in formation of a very important vitamins. So the body needs cholesterol for sure. Where it is being produced, it is produced by liver. You must have heard the term good cholesterols and the bad cholesterols. Basically, the bad cholesterols are those cholesterol which are carried from the liver, from the area where it is being produced, and then transferred to the blood streams. So that's why we call them bad cholesterols. What are good cholesterols? Are the cholesterol which goes from the blood to the liver. For example, if a person is riding a bike and going to the home, so means it's a good cholesterol is going back home. Whereas the one who is going from the home to in the roads, it's considered to be as bad cholesterol. So we have to control both good cholesterols and to make sure the good cholesterol and the bad cholesterol ratio, it needs to be adjusted.
Okay. While we are testing from the lab, it will separately mention that cholesterol is this much and triglycerides is this much. Triglycerides is related to this hyperlipidemia?
Yeah, these are all basically subcomponents. If you will do a function test, lipid profile or function test, it will tell you like subcomponents. It will tell you total cholesterol level. It will tell you LDL level, which I'm referring as bad cholesterol. It will tell you good cholesterol, which is HDL. It will also give you triglycerides. And if any one of those is not within the normal limit, later on I will tell you what are the normal limits.
Okay.
But if any one of them is, for example, the total cholesterol for an ideal person should be less than 200. The LDL, which I'm saying referring as bad cholesterol, needs to be less than 100. The HDL, good cholesterol, needs to be at least 60. We need it not less, but we need more, at least more than 60. And triglyceride should be less than at least 150. So if any one of those numbers are not matching or they're going deranged, means you are suffering from hyperlipidemia.
Okay. HDL, LDL, triglycerides. We have. Can you mention the normal limit and higher limit of these three items? HDL, LDL, and triglycerides.
Yeah, the normal limit now, because the guidelines keep on changing, European guidelines, American guidelines. So we have trying to do like to our patient-physician base is like if the total cholesterol, if it's less than 200, means you are doing good. Things are under control. Your diet is okay. Or if you're already on a medicine or a pill for cholesterol, it means it's working fine. LDL cholesterol, it's also one of the components. It's very important, cholesterol level. If it's less than 100, then once again you are doing good. If it's more than 100, means that you need to get it checked. You need to see your doctor, or you need medicine, or you might need a lifestyle change. So you need to work on that. Good cholesterol, which I told one more thing, is component is HDL. It should be minimum. It should be 60. If it's less than 60 milligrams per deciliter, means that you are not having an active and healthy lifestyle, or you are consuming a lot of trans fats in your food. That's why this cholesterol is not high. Ideally, it should be more than 60. And the triglyceride, which is common, we know everything about triglycerides, the fats and saturated fat. If it's less than 150 milligrams per deciliter, it's considered as normal. It means if you are, whatever you are doing, either your pills, exercise or food, you are doing great. But if it's more than 150, it's considered that you are having a hyperlipidemia.
What is the main cause of this hyperlipidemia?
Look, very good question. The main cause of hyperlipidemia is basically, it can have a lot of causes, but it's mostly related to our lifestyle. Okay. Of course, it is related to familial. We have family inheritance of hyperlipidemia. But of course, one of the most important factors that contributes hyperlipidemia is smoking, which of course we don't relate with hyperlipidemia. It's common known as, okay, if you smoke, you will have lung problem or you might have some abnormalities of the lung, but no, smoking plays an important part in hyperlipidemia. Increased alcohol intake plays a very important part in hyperlipidemia. And not eating nutritious food, it also contributes to hyperlipidemia. And people who have already some other medical problem, like, for example, people are having diabetes, people are suffering from hypothyroidism. It's a condition in which you have decreased function of thyroid. Or if the person is suffering from obesity, these are all factors that contribute to increase the level of the cholesterol or in the end causing hyperlipidemia. So once again, I will summarize these important parts. Number one is smoking, increased alcohol consumption, having a diabetes, obesity, having abnormal thyroid functions, or the family history of high cholesterol. Those are the factors that contribute for hyperlipidemia.
Okay. Yeah, smoking and alcohol consumption, that are more important points. Yeah. What happens if one patient has this hyperlipidemia?
Look, that's a very good question. The thing is, if you are suffering from hyperlipidemia, most likely chances are that you will not know that you are suffering from hyperlipidemia. Because, as I mentioned earlier, chances are very less that you will have any symptoms. You can live your normal life with hyperlipidemia until and unless it will cause you real damage, like the fat might deposit in one of the arteries of the heart, or it might block in one of the arteries of the brain. So that is the time that most of the people, mostly here in UAE, the health conditions are very good, the facility is very good, but still in most of the part of the Asia, it's very difficult to get yourself checked. And most of the people who comes from a stroke or a heart attack, at the end of the day, what is the cause we came to know? Yes, they used to have hyperlipidemia for many years, and they never know that they are having this condition, and they never took the medicine, they never changed the lifestyle, and then in the end they come up with heart attack or a stroke or some occlusion or a blockage of one of the main arteries of the legs or anything. So that's what happens in hyperlipidemia. But yes, most of the time it becomes silent. You will not have any symptoms. In some scenarios, we have noticed people are coming with having some deposition of cholesterol inside the eyes or around the eyes. That we have seen.
Okay, that's a main important point.
Yeah, that's why we always said that get yourself checked. You need to get yourself checked through a doctor or through a caregiver. That anybody nowadays who have the risk factor, which I already discussed, can suffer from hyperlipidemia.
Okay, doctor. We are going for a short break, and I will come back soon. Please hold on.
In Focus, brought to you by Burjil Geojit Financial Services. നിങ്ങളുടെ നിക്ഷേപങ്ങൾക്കൊരു വിശ്വസ്ത വഴികാട്ടി.
Sham Machinery Sharjah, metal working and duct making machines, maintenance services, foundation bolts for street lighting poles. Call 056-590-1580.
And London American City College, UAE, American European BBA, MBA degree courses. Original fee structure and 10% ചെലവിൽ പഠിക്കാം.
റെയിൻബോ ക്വാളിറ്റി മിൽക്ക് അവതരിപ്പിക്കുന്ന വിൻ ഗോൾഡ് വിത്ത് കറക്റ്റ് ക്യാമ്പയിന്റെ ഭാഗമായി നടന്ന രണ്ടാമത്തെ നറുക്കെടുപ്പിൽ 40,000 ദിർഹംസ് വിലമതിക്കുന്ന ഗോൾഡ് വോച്ചർ സമ്മാനമായി നേടിയത് 3 പേർ.
വിജയികളിൽ ഒരാളായ മുഹമ്മദ് റാഫിയെ നേരിട്ട് കണ്ട് അഭിനന്ദനങ്ങൾ അറിയിക്കുന്നതിനായി ഫെബ്രുവരി 9 ബുധനാഴ്ച രാവിലെ 10 മണിക്ക് റേഡിയോ ഏഷ്യ അവതാരകൻ അക്ഷയ് എത്തുന്നു DIP 2-ലെ ഷജ്രത് അൽ റിഫ് റെസ്റ്റോറന്റിൽ. റെയിൻബോ ക്വാളിറ്റി മിൽക്ക്, റെയിൻബോ മേക്സ് ബെസ്റ്റ് കറക്റ്റ്.
ഇനി പറയുന്നത് ശ്രദ്ധിച്ചു കേട്ടോളൂ. ഡക്ട് മേക്കിംഗ് മെഷീൻസ്, കിച്ചൺ എക്യുപ്മെന്റ് മെഷീൻസ് തുടങ്ങി ഒരു മെറ്റൽ ഫാക്ടറിക്ക് ആവശ്യമായ എല്ലാ മെഷീനറീസും നല്ല ക്വാളിറ്റിയിൽ ഷാർജയിലെ ഷാം മെഷീനറി സപ്ലൈ ചെയ്യുന്നു. മെയിന്റനൻസ് ഓഫ് മെഷീൻസ്, ഫൗണ്ടേഷൻ ബോൾസ് ഫോർ സ്ട്രീറ്റ് ലൈറ്റ് പോൾസ് തുടങ്ങിയ ആവശ്യങ്ങൾക്കെല്ലാം കോൺടാക്ട് ചെയ്യാം. ഷാം മെഷീനറി ഷാർജ 056-590-1580. വിസിറ്റ് shammachinery.co.
ഒരു വരമരുളിയത്.
അക്ഷയ്, നീ എവിടെയാ?
എടി എവിടെയാണോ എന്ത് എനിക്കൊന്നും അറിയാൻ പറ്റുന്നില്ല.
എടാ, ഇന്ന് നീ നിന്റെ സ്വന്തം കാറിൽ വരുന്നല്ലേ പറഞ്ഞേ?
അതെടാ, സ്വന്തം കാറ് ഞാൻ വഴി തെറ്റായിരിക്കാൻ മെട്രോയുടെ തൂണും പാളവും നോക്കി വരുവായിരുന്നു. ഇപ്പൊ നോക്കിയപ്പോ തൂണും കാണുന്നില്ല, പാളവും കാണുന്നില്ല. പിന്നെ നീ ആ ഷോ ഒന്ന് മാനേജ് ചെയ്തേക്കണേ. ഞാൻ ഇവിടെ ബെർദുബായുടെ റൗണ്ട് ഔട്ട് കറങ്ങിക്കൊണ്ടിരിക്കും. ഞാൻ വണ്ടി എവിടെയെങ്കിലും ഒതുക്കിയിട്ട് ഒരു ടാക്സി പിടിച്ച് വേഗം അങ്ങ് എത്തിക്കോളാം.
എന്തൊക്കെയായിരുന്നു മെട്രോ മാപ്പ്, ട്രാഫിക് അപ്ഡേറ്റ്സ്, ഡ്രൈവിംഗ് ലൈസൻസ്, പുതിയ കാറ്. പക്ഷെ മെട്രോയ്ക്ക് അണ്ടർ പാസേജ് ഉണ്ടെന്നുള്ള കാര്യം മാത്രം അറിയില്ല.
Music, news and lots of entertainment.
We'll keep you company every day.
Morning Buzz. Weekdays 6 a.m. to 9 a.m. Energized with the AA battery, Alize and Akshay. Brought to you by Sifar, sodium-free drinking water from Romana, and Green Farm Majlis, 1121 steamed basmati rice.
Namaskaram, this is Anu Sitara. You are listening to Radio Asia 94.7 FM.
The voice of Malayalis for decades. Radio Asia 94.7 FM.
പ്രേക്ഷതാക്കളെ ഇൻ ഫോക്കസ് തുടരുന്നു. ടുഡേ വി ഹാവ് എ സ്പെഷ്യൽ ഗസ്റ്റ്, ഡോക്ടർ സയ്യിദ് നാദിർ ഫ്രം ആദം വൈറ്റൽ ഹോസ്പിറ്റൽ. He is specialist internal medicine, head of medical department and medical director, Adam Vital Hospital. Today he is talking about hyperlipidemia. That means high level of cholesterol in our body. Dr. Syed Nadir.
Yes.
Yes, one important question you have already mentioned, then we have to say it once more. What are the risk factors of hyperlipidemia?
Okay, yeah. The risk factors of hyperlipidemia, I will tell you again. Now, number one is very important, is the family history. So once again, we have to be within ourselves. Even you're not going to a doctor, you need to be very active and careful in knowing that either your mom, dad, or any one of them, or your aunt, or any one of your siblings are they suffering from hyperlipidemia, number one. You by yourself suffering from a thyroid problem in which you have decreased function of thyroid, that's called hypothyroidism. Or if there is an increased obesity. What is obesity? We know when the body mass index is certain limit high, this is considered as obesity. Or if you are noticing that you are not having an active and healthy lifestyle and smoking or drinking too much alcohol or having diabetes. So these are the risk factors that put you at increased risk of developing hyperlipidemia in the next few years.
Okay. How does hyperlipidemia affect our body?
Yeah. As I told you that, look, when you hyperlipidemia, what it's commonly it means there is a increased amount of cholesterol or fat cells. They are going in the bloodstreams. I'm trying to make it very simple for the audience. So this is called hyperlipidemia. So what happens when these levels of fat cells stay there in the blood for a longer period of time, they started to collect together. And then they make what we call in medical term a plaque, which is called a deposition or a collection of fat cells. So once those collection happens in one of the major arteries of the brain or the heart, that's what happens. What it will do, it can cause a heart attack, can cause a stroke, it can result, or in a lighter way, it can cause a coronary heart disease, like in which you must have asked, patients are coming, you must have commonly seen that one of your friend or relative or any one of our relative, yes, they have stenting is done, or they have put some medical stent, or they have a minor heart attack. So these are the effects that hyperlipidemia can put on your body. Number one is heart attack, stroke, heart disease, or in the worst case scenario, God forbid, a sudden cardiac arrest. That has also been evident by the studies. If hyperlipidemia is untreated for a longer period of time, that can result in a sudden cardiac arrest. It was a study done in US on patients, and it was found that one of the causes of the sudden cardiac arrest was hyperlipidemia. So yes, hyperlipidemia can result in a heart attack, stroke, a coronary heart disease, sudden cardiac arrest, and some small vessels disease also.
Any group of people? I mean, age factor is there?
No, there is no age factor. Now we have noticed that because of the very erratic
young people also.
Yeah, from adolescents to younger generation to elderly, all are suffering from this condition. The numbers which I shared with you from UAE and from international, that covers all age group, and it is commonly seen now in everybody. As you know, commonly you can easily be served from us by soda. These trans fats are easily available outside in the market, so that's what is happening. That's why it's getting more common nowadays in young population.
Okay. What are the symptoms of hyperlipidemia? In between, you have mentioned something, but we have to say something about that.
Yeah. Look, people normally who have genetic problem with cholesterol, which I told you, who have family history of hyperlipidemia, which we call a familial hyperlipidemia, they tend to have cholesterol deposits, which medically we call as xanthomas. They collect around the skin. And that is one of the symptoms. But mostly, if you will ask, there is no specific symptom. For example, other diseases like diabetes, hypertension, they are all related. You must have, most of the time, you have patients comes with the symptoms. They might have increased urination or increased thirst. They are having lack of energy. In diabetes, I'm talking about. In hypertension, most common symptom we have seen as patient comes with a headache or patient comes with a numbness in the body. But with hyperlipidemia, mostly, that's why we call it silent disease, because it doesn't come with symptom most of the time. So that's why we have to be very careful in treating hyperlipidemia.
Okay, sir. We have to. Can you say something about the treatment part?
Yeah. Look, treatment. Once again, treatment is very important for hyperlipidemia. If you are being diagnosed with hyperlipidemia, then you have 2 to 3 options. The first option is, of course, the healthy and active lifestyle. So I will slightly go in a bit detail for the healthy and active lifestyle. How to get it? It's very easy to say, go for a healthy and active lifestyle, but how we can do it? So I will tell you that first of all, how to do it. Choose a healthier fat. Of course, you cannot live without fat, because it's very important for the need for the body. So once again, choose healthier fat. How to choose it? Avoid saturated fat that are found primarily in red meat, baked sausage, and this very common dairy products. They have very higher level of saturated fat. So if you want to choose something like chicken, turkey, fish, or if possible. Use of other fats like olive, avocado, canola oil for cooking. These things will help to reduce. Yeah. Okay. And another way of doing it, it's very easy. Trans fat is found in the fried food, like cookies, crackers, and other snacks. So once again, try to cut those things down. Use of fish, salmon, these things are more beneficial. Even it has been noticed that some walnuts and other kind of nuts, they also help in reducing the hyperlipidemia. So this is the healthier and active lifestyle.
Okay. We have to avoid red meat. Is it? Hello? Dr. Syed Nadir, can you hear me? Hello? Doctor, can you hear me? Okay. Dr. Syed Nadirന്റെ ലൈൻ ഡിസ്കണക്ട് ആയിരിക്കുകയാണ്. അപ്പം നമുക്ക് ഒന്നുകൂടെ അദ്ദേഹത്തെ കണക്ട് ചെയ്യണം. അപ്പം നമ്മൾ ചെറിയൊരു ബ്രേക്കിലേക്ക് വീണ്ടും പോവുകയാണ്. ഷോർട്ട് ബ്രേക്കിന് ശേഷം വീണ്ടും നമുക്ക് അദ്ദേഹത്തെ കണക്ട് ചെയ്യാൻ പറ്റും എന്നാണ് വിശ്വസിക്കുന്നത്. അദ്ദേഹം സംസാരിച്ചുകൊണ്ടിരിക്കുന്നത് ഹൈപ്പർ ലിപ്പിഡീമിയെ കുറിച്ചാണ്. അതായത് ഒരുപാട് ആൾക്കാർക്ക് ശരീരത്തിൽ ഹൈ കൊളസ്ട്രോൾ ഉണ്ടാകാറുണ്ട്. ആ ഒരു ഹൈ കൊളസ്ട്രോൾ എന്ന് പറയുന്നത് തന്നെയാണ് ഹൈപ്പർ ലിപ്പിഡീമിയ എന്ന് പറയുന്നത്. അത് പക്ഷേ സൂക്ഷിക്കേണ്ട ഒരുപാട് ആൾക്കാരുണ്ട്. അദ്ദേഹം പ്രത്യേകം തന്നെ എടുത്ത് പറയുകയുണ്ടായി. സ്മോക്ക് ചെയ്യുന്ന ആൾക്കാർ, അതുപോലെ തന്നെ ആൽക്കഹോൾ ഉപയോഗിക്കുന്ന ആൾക്കാർ, മദ്യം ഉപയോഗിക്കുന്ന ആൾക്കാരൊക്കെ വളരെ ശ്രദ്ധിക്കേണ്ടിയിരിക്കുന്നു. അതുപോലെ ഡയബറ്റിസ് ഉള്ള ആൾക്കാർ, ഹൈ ബ്ലഡ് പ്രഷർ ഉള്ള ആൾക്കാർ, കിഡ്നിയുമായി ബന്ധപ്പെട്ട് അസുഖമുള്ള ആൾക്കാർ, ഇവരൊക്കെ വളരെ ശ്രദ്ധിക്കേണ്ട ഒരു കാര്യമാണിത് ഹൈപ്പർ ലിപ്പിഡീമിയ. അപ്പോൾ ഹൈപ്പർ ലിപ്പിഡീമിയ പലർക്കും നമ്മുടെ ശരീരത്തിൽ ഒരുപാട് പ്രശ്നങ്ങൾ ഉണ്ടാക്കുന്നുണ്ടെന്നാണ് അദ്ദേഹം പറഞ്ഞത്. അത് വളരെ സൂക്ഷിക്കേണ്ട ഒരു കാര്യം കൂടിയാണ്. ഒരു ഷോർട്ട് ബ്രേക്കിന് ശേഷം ഡോക്ടർ സയ്യിദ് നാദർ നമ്മൾ വീണ്ടും ലൈവിലേക്ക് കൊണ്ടുവരുന്നതാണ്.
In Focus, brought to you by Burjil Geojit Financial Services. നിങ്ങളുടെ നിക്ഷേപങ്ങൾക്കൊരു വിശ്വസ്ത വഴികാട്ടി.
Shyam Machinery Sharjah, metal working and duct making machines, maintenance services, foundation bolts for street lighting poles. Call 056-590-1580.
And London American City College, UAE, American European BBA, MBA degree courses. Original fee structure and 10% ചെലവിൽ പഠിക്കാം.
ഇനി പറയുന്നത് ശ്രദ്ധിച്ചു കേട്ടോളൂ. ഡക്ട് മേക്കിംഗ് മെഷീൻസ്, കിച്ചൺ എക്യുപ്മെന്റ് മെഷീൻസ് തുടങ്ങി ഒരു മെറ്റൽ ഫാക്ടറിക്ക് ആവശ്യമായ എല്ലാ മെഷീനറീസും നല്ല ക്വാളിറ്റിയിൽ ഷാർജയിലെ ഷാം മെഷീനറി സപ്ലൈ ചെയ്യുന്നു. മെയിന്റനൻസ് ഓഫ് മെഷീൻസ്, ഫൗണ്ടേഷൻ ബോൾസ് ഫോർ സ്ട്രീറ്റ് ലൈറ്റ് പോൾസ് തുടങ്ങിയ ആവശ്യങ്ങൾക്കെല്ലാം കോൺടാക്ട് ചെയ്യാം. ഷാം മെഷീനറി ഷാർജ 056-590-1580. വിസിറ്റ് shammachinery.com. പ്രണയത്തിന്റെ നിറങ്ങൾ ചാലിച്ച് റേഡിയോ ഏഷ്യയും ജോയ് ആലുക്കാസും നിങ്ങൾക്കായി ഒരുക്കുന്നു ബി മൈ വാലന്റൈൻ.
റേഡിയോ ഏഷ്യ പരിപാടികളിലൂടെ 10 വിജയികൾക്കായി ജോയ് ആലുക്കാസ് നൽകുന്നു 500 ദിർഹംസിന്റെ ഗിഫ്റ്റ് വൗച്ചറുകൾ.
ജോയ് ആലുക്കാസിൽ നിന്നും ഇപ്പോൾ 2000 ദിർഹംസിന്റെ ഡയമണ്ട് പോൾക്കി പേൾ ആഭരണങ്ങൾ വാങ്ങുമ്പോൾ 100 ദിർഹംസിന്റെ ഗിഫ്റ്റ് വൗച്ചർ വാലന്റൈൻ സമ്മാനം. ജോയ് ആലുക്കാസ്, വേൾഡ്സ് ഫേവറേറ്റ് ജ്വല്ലർ.
അല്ല, ഇവിടെ എല്ലാവർക്കും ഇഷ്ടമുള്ള പാട്ടുകൾ കേൾപ്പിച്ചു കൊടുക്കുന്നതായി കേട്ടു. ഈ പാട്ടുകൾ ഡെയിലി കേൾപ്പിക്കുന്നുണ്ടോ? അല്ല, എല്ലാ ദിവസവും ഇങ്ങോട്ട് വരണോ എന്നറിയാനാ.
വേണ്ട, നടന്ന് ബുദ്ധിമുട്ടണമെന്നില്ല. മേൽവാസം തന്നെ അങ്ങോട്ട് അയച്ചുതരാം.
എങ്കിൽ അഡ്രസ് എഴുതിയെടുത്തോളൂ. MP അംബുജാക്ഷൻ, മലയാള നോവലിസ്റ്റ്, അംബുജ ടൈലേഴ്സ്.
മതി. ആദ്യ അഡ്രസ്സും വേണ്ട, ഫോൺ നമ്പറും വേണ്ട. 05855809447 എന്ന നമ്പറിലേക്ക് ഒരു വാട്സ്ആപ്പ് അയച്ചാൽ മാത്രം മതി. നിങ്ങളുടെ ഇഷ്ടഗാനങ്ങളുമായി വീക്ക് ഡേയ്സിൽ ഉച്ചയ്ക്ക് 1 മണി മുതൽ 4 മണി വരെ ഞാനുണ്ടാവും. യെസ്, ദിസ് ഇസ് മീ, അഞ്ജന.
Rhythm Request, brought to you by Eastern Chicken Masala.
Hi, this is Ronnie Raphael. You are listening to Radio Asia 94.7 FM.
Stay tuned and enjoy good music on Radio Asia 94.7 FM.
പ്രിയ ശ്രോതാക്കളെ, ഡോക്ടർ സയ്യിദ് നാദർ വീണ്ടും നമ്മളോടൊപ്പം ലൈവിൽ ചേരുകയാണ്. ഡോക്ടർ സയ്യിദ് നാദർ.
Yes.
Yeah. It was disconnected in between.
No problem.
Okay, sir. Okay, we will continue the talk and...
so we were discussing regarding how to treat this hyperlipidemia.
Yeah.
So I will tell again for the audience is to go for a healthy and active lifestyle. First of all, try to cut down saturated fat, okay?
Mm-hmm.
And cut down the trans fat. What is the trans fat? The fat which you commonly see in fried food and processed food like cookies, crackers and other snacks.
Mm-hmm.
And choose for a healthier fat and choose for a healthier product like chicken, turkey, fish. If possible, try to avoid red meat, bacon, sausage and full fat dairy products. Now in the market, it's very easily available, less fat, skimmed products are easily available. So go choose those option instead of a full fat dairy products.
Is low cholesterol milk or skimmed milk is good for health?
Yes. Because of course the problem is, we have to live also together. The problem is most of the time it's very unnatural to say, okay, you go zero cholesterol or zero fat.
Mm-hmm.
It's difficult to continue for the rest of the life. You have to be in a moderate way to choose products which you can use for longer period of time.
Mm-hmm.
For example, if you are taking milk, go for a skim milk or a low fat milk instead of a full dairy product. If you are fond of ice cream and you have to have ice cream, then go for a low cholesterol or a less saturated fat ice cream now available in the market. But ideally, it should be avoided. Fried foods should be avoided. Those are the things which are nowadays increasing the cholesterol level in the younger generation.
Mm-hmm.
Because easily these things are available in the market. Use of high fiber intake, it's very recommended, which includes fruits, beans, vegetables.
Mm-hmm.
They will help a lot in reducing the hyperlipidemia. Oat, it's very good. It will help reduce in hyperlipidemia. So once again, the use of oat, fruits, beans and vegetables, they are recommended from the associations to control the hyperlipidemia.
Okay. Doctor, are some medicines may increase cholesterol levels in the blood?
Yes, it's a very good question, because normally we think that only the food or the familial hyperlipidemia can cause high cholesterol levels, that is hyperlipidemia. But yes, there are certain medications that are used for blood pressure. I use some contraceptive pills used by females for certain reasons. They may increase the cholesterol level. So once again, if you are thinking that you are doing a healthy and active lifestyle, you are not taking too much of the trans fat, and still your cholesterol is high in the blood, so you need to check if you are taking any of the medicines that controls the blood pressure, or contraceptive pill, or some certain other medications that we will discuss, of course, later, that can cause the increased cholesterol level. So those things needs to be adjusted also.
Okay. How soon will the hyperlipidemia treatments start to work?
Yeah. Normally the treatment is once you start the treatment for hyperlipidemia, because first I want to tell you that, like, if you tried healthy and active lifestyle and still your cholesterol are high, so of course your physician will advise you to start on the medication that is called tablets. They will start once a day tablets or twice a day tablet. So after the starting of the medication and the lifestyle, it will take at least 2 months for the medication to work, and will repeat the cholesterol level.
Okay. How hyperlipidemia can be improved?
Look, hyperlipidemia, as we discussed, can be improved by exercising, number one. According to the American Heart Association, it is advisable to walk for at least 150 minutes per week. So you can do it around 30 minutes per day, along with 1 day off. So it will give you around that time. So minimum of 150 minutes.
150 minutes in a week.
So you need to try to achieve that goal. Number second is try to quit smoking if you're already doing it.
Yeah.
Sleep is very important factor, because sleep is related to stress. If you're not sleeping well, your stress hormones will become active, and that at the end might result in increased cholesterol, cholesterol level in the blood. So sleeping at least 7 hours each night is very important. Keeping your stress level under control is very important. Eating healthier food, which I discussed earlier already. Eating healthier food is very important, and try to lose few pounds to reach a healthy weight. So those are the steps that we need to take to attain a good lifestyle. And you know what it will done? It will done at the end of the day. It will reduce the cholesterol level and it will reduce the hyperlipidemia.
Okay. Doctor, is hyperlipidemia is a disability, or how can we say about that?
Sorry, I didn't pick you.
Yeah, is hyperlipidemia is a disability? Can we say it's a disability, or it's a disease, or it's a condition?
No, it's not a disability. It's a disease, of course, that can be prevented with if it's taken down at the right time. Even though, for example, if it's been not taken at the right time, if the patient doesn't come to the physician on the right time, if he comes years or months later, even then it can be corrected and through lifestyle and medication. But yes, it's a disease that can be managed, that can be prevented if it's taken on the right, if it's got stuck at the right time, that can be done. Yes, of course.
Who are on high risk while giving the treatment of this hyperlipidemia?
Look, the people who treatment is there. If you're asking regarding the treatment, for the treatment there is both availability for the.
No, if people have diabetes, people have some kind of heart diseases and kidney diseases. They have any risk while giving them the treatment or medicine?
Yes. Yeah, of course. I will tell you, look, there is always risk versus benefits. if you will give a tablet to anybody, there is always chances you might have some risk. But of course, in hyperlipidemia, the benefits outweighs the risk. And in the people who are having diabetes, kidney disease, or hypertension, there is no as such proven side effect that can tell you to avoid the medication for hyperlipidemia, because in the market there's a lot of medicines available that is suitable for specifically for diabetic patients. There are a certain group of medicine that will be helpful for patients who have kidney diseases or who have high blood pressure. So that is the recent modern technology and medical advancement has done to us, that there is a lot of treatment available catered to specific problem. If you are a patient is suffering from a hypertension, blood pressure, kidney problem, and diabetes, yes, of course, there is medicines available for hyperlipidemia. And nowadays, it's not approved now, still in the US, but in other market it's approved. Now there is injections also available. There are subcutaneous injection to control the cholesterol level. But once again, they are the last resort or the treatment for hyperlipidemia. Initially, once again, the go treatment is healthy and active lifestyle, avoid too much of the trans fat or saturated fat. And if it's not still the cholesterol levels are high, then you need to be on the medication for at least good 3 to 6 months. You need to repeat the cholesterol level every 3 to 6 months and then find out where you are going. If the medication suits you, you don't have any problem with that, of course, continue the medications. But keep on checking your cholesterol level every 3 to 6 months.
Okay. Yeah, you have already mentioned about the food habits. You said that eat a diet lower in saturated and trans fats, include lots of fruits, vegetables, beans, nuts, whole grains, and fish regularly into the diet.
Yes.
And to limit red meat also.
Yeah, we need to limit the red meat, because once again it has too much saturated fats in it, and that will end up with increasing the cholesterol level in the blood.
Yeah, and quit smoking and quit alcohol consumption also.
Of course.
Okay. We have a question from a listener. He says that I have gallbladder stone and fatty liver grade 2. I have consulted a doctor. Doctor said I have needed a surgery for gallbladder stone. Any other option to avoid surgery? He's asking.
Okay, very good question. Once again, it's related to the surgical field. Normally, general surgeons, they are the one doing the surgery. But if you have a gallbladder stone, and if it's not hurting you, now this is the important point. If the gallbladder stone is obstructing or it is causing any pain, it might result in nausea, abdominal pain, distension after eating food. If you are suffering from those symptoms there, then it's better to get it removed. Why? Because sometimes what happens is the gallbladder stone lodges out and stuck in one of the tubes. Mm-hmm. So then it's a kind of a surgical emergency. If you are experiencing any one of those symptoms, it's better to get it done. But of course, the general surgeons or the surgeon specialists, they will be more in a nicer position to answer, to see you. But if the doctor has advice and if you're experiencing any of those symptoms, it means you might need a surgery.
Okay. Better you have to remove that.
Yeah.
Okay, sir. We have 2-3 questions.
Sure.
Yeah. One listener asking that what foods are good for hyperlipidemia. Actually, we have mentioned that, but one listener is asking about the food also.
Look, food, it's very common thing. Everybody is eating food. If you are from Asian ethnicity, we know what kind of food we are eating, but try to reduce the saturated fat from your food.
He is asking, need to avoid poultry. He's asking, need to avoid poultry and red meat.
Yes, we have to avoid red meat. If he's a non-vegetarian, then of course bacon, sausages, they are can have high amount of saturated fat. Along with full-fat dairy products, which includes creams, ice creams, There's every creamy yogurts. People are going for a creamy yogurt than for a normal yogurt with low fat. So those are the small steps that needs to be taken when you go to a supermarket anywhere. Go to a supermarket, just focus on the fat amount, look on the component, that either this thing has too much saturated fat or it's a less fat or it is zero fat. So those are the things, if you start doing it, when you are going to buy, everybody buys cooking oil. If you are going for a cooking oil, try to get a cooking oil with low fat or a monosaturated fat like olive oil, avocado oils or canola oils for cooking, instead of a high saturated, or in our Hindi language we used to say ghee or some other trans fat. Avoid those stuff. So those things, of course, if you will do, the cholesterol levels will go down for sure.
Okay. Thank you, Dr. Syed Nadir.
No, it was a pleasure.
Yeah, it's a very nice talk. You have your advice is very important for us, for our listeners.
No, thank you.
Thanks once again for attending this session.
Thank you.
Thank you, Dr. Syed Nadir.
Bye.
ശ്രോതാക്കൾ ഇത്ര നേരം സംസാരിച്ചത് ഡോക്ടർ സയ്യിദ് നാദിർ ആണ്. അദ്ദേഹം സ്പെഷ്യലിസ്റ്റ് ഇന്റേണൽ മെഡിസിൻ ആണ്, ഹെഡ് ഓഫ് മെഡിക്കൽ ഡിപ്പാർട്ട്മെന്റ് ആൻഡ് മെഡിക്കൽ ഡയറക്ടർ ആദം വൈറ്റ ഹോസ്പിറ്റൽ. അദ്ദേഹം പാകിസ്ഥാനിയാണ്, അതുകൊണ്ടാണ് അദ്ദേഹം നമ്മുടെ ഭാഷയിൽ സംസാരിക്കാൻ പറ്റാത്തത്. അതുകൊണ്ടാണ് അദ്ദേഹം ഇംഗ്ലീഷിൽ തന്നെ സംസാരിച്ചത്. പക്ഷെ നമുക്ക് വളരെ ഇമ്പോർട്ടന്റ് ആയിട്ടുള്ള ഒരു ഡോക്ടർ ആയതുകൊണ്ട്, ഒരു ഇമ്പോർട്ടന്റ് ടോപ്പിക് കൂടെ ആയതുകൊണ്ടാണ് അദ്ദേഹം ഇംഗ്ലീഷിൽ തന്നെ സംസാരിച്ചത്. വേറൊരു ഭാഷ നമുക്ക് ചോദിക്കാൻ പറ്റില്ലല്ലോ.